This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, so UT Health San Antonio, welcome guys. I like to start to say by, our power is in our residents. At UT San Antonio, we really hold, we really count on family. You're not just here for 4 years of your time. We really depend on each other. We really, seek that friendship, that I guess you could say love between each other, where we could depend on each other, study together, have fun together. So if you're looking for a family-like resident, UTESCA is definitely the place to be. All right. This is our program leadership, Dr. Gutierrez. She is our department chair and also program director as of now. She is working at the University Hospital, also an employee at UT Health, and she specializes in brain injury and interventional spasticity. Then we have two associate program directors, Dr. Ragunadin, we call him Dr. R. He did a 1-year fellowship for interventional MSK spine. He's also a UT Health attending. And then Dr. Tapia, she's our polytrauma section chief who specializes in brain injury, and she's at the VA site. Our program growth, we've been growing exponentially since even before I got here. We basically are creating a new women's and children's hospital. It's about a $500 million project, and it is beautiful. They said it's going to be expecting to opening maybe late 2022, early 2023. And this building is also going to include a pediatric rehab gym. So for us, our pediatric rehab at UTESCA, it's just growing exponentially. So we're going to have a whole different gym just dedicated to pediatric rehab, which is pretty exciting. We also, at UT Health, we have a new cancer rehabilitation department who, on the right here, Dr. Fricke is standing next to Dr. Biden, First Lady, and basically he opened up this department, and it's something that we're basically getting to go, and is growing rapidly. We also have a dedicated spine center and a new hospital by UT Health that's being built. The VA, we have new MSK faculty and clinics as well. And at University Health, we have a TBI, a spinal cord fellowship, and a women's and children's hospital that I mentioned earlier. And here are the training locations. So we train up about 6 locations: University Hospital, Otto Lee Murphy, Children's Hospital San Antonio, Warm Springs Rehab Facility Center. We also work at the San Antonio Military Medical Center. We call it SAMC. And then there's also the Texas Center for Athletes, where we do a lot of our sports and medicine. And all regions are pretty much drivable. Like basically, depending on where you live, it can be anywhere from an average of 15 to 30 minutes, at most 30 minutes. If there's traffic, yeah, you can get into the 40-minute range, but it's pretty much all close together. And like I said, this is just a picture of the training locations. We have University Health and the VA. You'll spend most of, like 50% will be at the VA, then about 30% will be at University. And then the rest of the 20% will be between everything else. The only thing you don't see here is basically Westgate. And like I said, depending on where you live, everything is pretty much drivable. I live in the medical center as well, and everything's like 5 to 7 minutes away. So our PGY1 program structure, and this is what makes us unique. And so I'll just say it real quick, and I'll let Shahana give like a little testimony of her PGY 1 year so far. Basically, we have 5 months of inpatient medicine. Part of those 5 months is STICU and MICU. Then we have 6 months of ortho, neuro, rheumatology, and geriatrics. And out of those six, there's 3 months of ortho, which we get a bunch of procedures. So we get a lot of peripheral joint injections, and there's not a lot of programs that do that. So I think PM&R's, if you go to AB PM&R, the requirement's about 25 peripheral injections. I have about like 102 injections that I've done. And then we also do 1 month of PM&R consults as well. And what we try to do is we try to get you guys coming here to be part of the rehab community from day one. There are so many, this program is a categorical program. So you may be off doing other services, but we make sure to keep you guys in the loop. And here's our lovely new PGY1s, and Shahana is actually in this picture. And Shahana, I don't know if you want to give a few words of what it's been like for you at UTUSCA so far, if you want to go ahead and give your testimony.
Yeah, of course. So I will kind of echo what Deji said in that, like, people are the biggest, the most important, most fun part of this program, and it is a big reason why I picked it. But also, there's so many other perks. And for me, the intern year was also a big draw because I heard that it was just very all-encompassing, very PM&R focused. So I've done 2 months of I've done inpatient wards and inpatient neuro so far. My roommate has been on ortho, has learned a lot, has done a lot of injections as well, and done a lot of procedures. It's kind of, what you want to make it. They help tailor it to be what you want, so you can actually go to the OR if you want to during ortho as well to see procedures, but it's not a requirement at all. So I feel like, and being at the VA, I feel like it's actually very there's a lot of freedom to kind of cater it to what you want to be as well. If you talk to your attendings and your upper levels, and kind of tell them what your interests are, and they kind of know, they will try to get you more exposure. And then, like Deji was saying, from like literally before even day one, we were just like really included in the family. We're always going to happy hours, which I think is really rare. I wasn't expecting as an intern this early on to be so I guess close to my upper levels, but I feel like every single person here I have a good relationship with. Luisa got me coffee today. Yeah. So I feel like it's just a really supportive culture, and it's been a good experience so far. I wouldn't pick any other place.
Thank you, Shawna. We appreciate you. So moving on.
Deji, can I interrupt because I have to, I want to shame a little spiel real fast to everyone. Hi. Yes, Monica Verduzco Gutierrez. Nice to meet everyone. Thanks for being here to come learn about our program. I am in a middle school doing my son's Meet the Teacher night. And so in a little bit, the bell's going to ring and I'm supposed to be in a room listening about his class. And so one thing that's also important is that you have time for things that you need to do, including the faculty. So we want everyone to have, time to teach and time to see patients and time to develop leaders, but also time to, you have your responsibilities, but then you still need to have time for your family. And that's something that's really important. And we want to model it from the top down. The other thing is that we recently had a mini faculty retreat, and we talked about, what's the mission, what's the vision of the department, what's the mission? And part of our educational mission is, when we really talk to the faculty, is we want to train future leaders in the field. And so does that mean that you're going to be, a leader of a team, a leader of your practice, a leader of maybe the whole, PM&R field or a department? And so those are the people that we want. We also, want people who are going to be engaging with continuous lifelong learning and, improving themselves always, both at a work level and at a personal level. So those are things that are really important to our department. Thank you for being here. I'm going to go. I'm already tardy. So
thank you, Dr. Gutierrez.
You're welcome. Bye.
So yeah, one team, one heart. As you can sense, we're family here. Like if someone's hurting, I'm hurting, and I'm gonna call them. And we basically check up on each other every single month, especially when you start, your intern year. It's tough. It's new city, new people. You don't know anyone, so it's definitely tough. Moving on to to the PGY 4 year. So PGY 2 year to PGY 4, basically we have inpatient rehab. We'll have a general rehab unit at UH, which is Reeves. We'll do about 4 months your PGY 2 year, 2 months your PGY 3 year, and no months during your PGY 4 year. We also have a polytrauma unit that's 1 of 5 in the country. It's amazing. You do about 1 month you do 2 months from PGY 2 to PGY 4. And then spinal cord injury unit as well. We have a dedicated spinal cord injury unit. There's not a lot of those as well. So we get a great education on spinal cord injury if you're interested in that. We also will rotate at pediatrics at the Children's Hospital of San Antonio as well. And we also, right now, we currently have an inpatient service at UH that is continuing to grow as of now. So just moving on, let me get this out the way, I'm sorry. Outpatient, we have outpatient TBI, spinal cord, pediatrics, interventional pain, MSK, sports medicine. I could read on, but basically what I'm trying to say is that we are the program where you'll get everything. You're not just going to get interventions. You're not just going to get MSK medicine. You're going to get everything. This program is going to make you the best physician that you want to be. And that's why I chose this program. And we actually have some PGY2s on here, Louisa, Luke, and Anna Marie. And I don't know if they want to say something real quick about their experience thus far as a PGY2 rotating in our PM&R program.
So far, I love my PGY 2 year. Intern year, you don't get a whole lot of experience in PM&R, mostly because it's like other programs, it's focused on internal medicine. And it's definitely gratifying, like falling in love with rehab. And I've had a phenomenal experience. It's also a bonus to have your weekends off with only 13 call shifts this year. So it comes in it's pretty clutch.
All right, Luke and Marie, if you guys want to say anything real quick.
Yeah, I mean, PGY2 is great. It's PM&R. Like, if you're on this call, you already know you like PM&R. We don't need to sell you on that. I'll just double emphasize what Shahana was saying. Like, the fact that there's a PM&R intern on this call should tell you something, because most programs don't have those. And if they do, a lot of times they're lying and they're just a medicine prelim, and they don't go to the didactics or anything. So being an actual PM&R resident when you're a first year is just so dope. And I couples matched, so that was like super extra dope. And then San Antonio is super cheap to live here, even despite everything that's happening in the economy right now. Like, you can survive on a resident salary. Like, that's a Peloton, so it can be done. That's all I have to say.
So I'm going to move on because we have a little bit to talk, but we do a lot of procedures here at our facility. You basically get over it's EMGs. We get over 200 every time you rotate with EMGs. So if you want to do EMGs, any type of ultrasounds, our didactics is very diverse, where basically we don't only just give lectures, but we learn how to do procedures like refill of baclofen pumps. And as you see here, Dr. Yersley is practicing. And then over here, we're doing some ultrasounds and our seniors are teaching us. So we do a lot of procedures here at UH and the VA especially. And like I said, PGY 1 year is very unique, where you have 3 months of orthopedics and you're guaranteed, I honestly, for what I can say, you're guaranteed to have at least over 20 procedures with peripheral joint injections. So our call schedule is pretty great here, and it's because we're a big we have big numbers of residents, so we're able to spread out our resident call, and it's not so strenuous on each other. So PGY 1, you don't have any call except when you rotate on MICU or medicine. PGY 2 year, you have 12 to 13 Saturday, Sunday shifts, which are 24-hour calls. If you work a Sunday, you'll get Monday off. PGY 3 is 6 to 7 on Fridays, and then PGY 4, you have none, just backup call, okay? And PGY 3, you also have backup call. Then we also have night floats, which we work 4 nights, Monday night, Tuesday night, Wednesday night, Thursday night, but then we have a 3-day weekend, which is pretty great as well. And our didactics are every Thursday and Friday for 2 hours each, 8 to 10. And like I said, we do a lot of things. We don't only just go up there and just talk. We look at M&M cases. We do oral board preps. We do journal clubs. We do monthly board questions. We get a really great education here at UTESCA. And then research is unlimited here. Like, if you want research, you can definitely do research here, whether that's pain and spinal cord or TBI. I know Louisa here is really big into research, her and myself, and we just went to a conference and we were able to complete some research for the pain department. Especially we have an annual UT Health San Antonio Rehabilitation and Research Day every year where we can present our research that we've done through the year. So our program also recognizes us for our achievements as well. And then we get involved in our community a lot. Like, so here, the picture to our right, it's a PGY2, Samantha Brown, and PGY3, Grant Dixon, and they're at a sporting event. And here we have a yearly project, a yearly service we call Project Men, where we basically partner up with a nonprofit called Project Men, and we are able to fix and clean out durable medical equipments for patients who are disabled. So those who have spinal cord injuries or those who are basically that have traumatic brain injuries, we definitely get involved in our community here in San Antonio. And, you know, this is just talking about I would say, what's our community like? You know, we have a lot of fellowship here. We have wellness committees. We go out, as Johanna said, to happy hour, to have some fun. We go on marathons. We do fantasy football together. There's a talk with a doc with the Women's Bistro every month where basically it's tailored for our women, where they could talk about the difficulties in medicine, being a woman, and the different advances and the opportunities for women and minorities. So we also have a faculty mentorship program as well, where they'll pair you up with a faculty. They'll basically be meeting them. You'll be meeting with them once a month and try to reach your goals that you're trying to complete during residency. And here are some just pictures that we took throughout the year. So over here, you'll see our PGY2s here. We did, this was their intern retreat where we went to the river and we floated on the river for about 4 hours. I missed that event, unfortunately. I was on call, but it looked a lot of fun. Over here, we had a Christmas party. We have a yearly Christmas party, and this was at one of our chief's residents, Dr. Potter's house, and it was a lot of fun. We go play top golf. We love barbecue. Me and Dr. Yersley, we kind of try to fight for that title of who's the best barbecuer in our program, and he probably has that title. And just more pictures here. While we go to conferences, we have dinners with companies that want to take us out and trying to recruit us, basically. We go to conferences. We just have a good time. San Antonio is an amazing place to be. And here at San Antonio, as I said, it's great here. It's a low cost of living. You can afford a house. I was able to buy a house since I've been here. There's a lot of things you can do downtown. There's the Riverwalk. There's a bunch of hikes you can take. As I said before, you can go tubing. And there's the Pearl, which is kind of like a farmer's market, which is very enjoyable. Traveling is not too bad. You're near Austin, which is an hour and 10 minutes. So anytime you want to go to Austin and have a good time, you can go there. You can go to Houston, Dallas, flying. There's like a 30-minute flight. The beach is only a 2-hour drive as well. And there's a lot of food here. San Antonio, it has one of the highest rates of high cholesterol here, cardiovascular disease, and that's for a reason. And we have mild winters. So the last time it snowed here was 2021 February. And if you have spouses that are looking for jobs, it has a great job market here as well. And last but not least, just to show you what the people that we graduate here to our right is our PGY. These are our PGY4s last year, who basically graduated, and 6 of them went into fellowship, 4 pain, 2 pediatrics, and 2 of them went into private practice. So if you want to do fellowship, you can. If you don't want to do fellowship and you want to go into private practice, you can definitely do that as well. And that shows you from the following classes, because a lot of people in the previous classes went private practice. And that is our presentation. Like I said, my name is Deji Olusanya. My email is here. If you want student outreach, you want to reach out to me or Dr. Yersley as well. So we'll open the floor for questions as of now.
Well, thank you so much. Just want to let you know you have about 5 minutes for questions.
Awesome. Okay. So any questions you guys have? Okay, great presentation. Any opportunities with adaptive sports in the program or in San Antonio? Yes.
Yes.
Go ahead. Go ahead.
This weekend, actually, a lot of us volunteered for wheelchair rugby. It was a 2-day weekend. There's actually sign-up sheets for all wheelchair activities. One of our attendings, he has a cervical spinal cord injury and he scuba dives and is very involved too. So there's a lot of huge opportunities with adaptive sports here.
Any other questions as of now? There we go. There's a lot of questions previously, but I think you guys did a great job of answering them.
I'm not sure about the IMG question. I can't really speak to it, just don't know. Partnerships directly with professional teams, like with a residency program, I'm not aware of, but the main like clinic that we have our sports exposure through, they're the docs for the Spurs, which one negative about San Antonio, we really only have like one big professional sports team. Like we should have an NFL team and a Major League Baseball team, but we have the Spurs and we work with the docs for the Spurs. Yep, and then there was a question about a continuity clinic. We don't have a continuity clinic with the residents. I don't know if that's a good thing or a bad thing, but when I've talked to my internal medicine colleagues, they hate their continuity clinics. So take that for what it's worth.
I'll tell you this though, we don't have a continuity clinic, but a lot of the patients you see, since PM&R is a field of like long-term relationship, you'll continue to see that those patients, whether you come on the rotation and come off the rotation. So some of the patients we see on spinal cord inpatient, they'll come on the outpatient side and you'll see them and you'll have that continuity of care in some way. Same thing with TBI. So even though we don't have a specific continuity of clinic, you'll see those patients multiple times and create that relationship.
Hey, Dad, I was just gonna chime in on the pro teams and like how we can get involved with that. So not adaptive sports, just like sports if you're interested in sports medicine. So our regular sports med rotation, we work with a big group of sports medicine docs and orthopedic surgeons, and that's the local sports medicine fellowship basically. And they have like every single high school and every single college in San Antonio. So that's there's like 5 colleges in San Antonio. UTSA is just one of them. And we're commonly involved with a lot of their sideline coverage, like as much as you want. They would love to have you. So I was doing sideline football coverage my intern year when it wasn't crazy, but yes, through them we have partnerships with all of the high schools and all of the colleges, but I think it's really hard. Like you have to be really involved to do something with like UTSA, like Luke was saying.
Awesome. And this is Dr. Tata, by the way, she's our chief resident.
Sorry, I was late.
You're okay. Any other questions, guys? Okay, I guess that's it. We appreciate you guys for the time. If you guys want to reach me, I'm going to put my email in the chat as of now. And I think everyone else can do so as well. You guys should just message us, whatever you need. That was an accident, actually. Let me see. There you go. And thank you guys for the opportunity to come on here. Thanks for listening. We appreciate you guys.
Yes, thank you so much for joining us tonight.